Hello everyone. In this video we're going to discuss the normal anatomy, what you should be looking at in a normal MRI after the lumbar spine, the lower back. Again, some of you might have some back pain, some leg pain and got an MRI or some CT scan of your lower back, and then you don't know what it looks like. What is normal? What is abnormal? What should you be looking for? And when you go to the doctor's office, it actually helps to have some idea about what they're going to talk to you about and look at the images and let them explain your MRI. But for them to explain to you and for you to understand it, I think it's best to know the basics of what you're looking at and have some understanding going in. In any case, we're going to keep this very simple. The lumbar spine is the lower back of your spine. If you touch the small of your back, basically, and below, that's where your lumbar spine is. If you touch your back, most of you can feel your bones in the back, and those are the bones here. And this area is the skin and the fat underneath. So in some people, it's very thin. You can easily feel the bones. Most of you can. So look, the way that you're looking at this MRI right now is exactly if somebody is cut straight in half, down the middle, and then you look from the side, that's what you see. So this person's cut in half, the back is here, and the front is here. The belly and its contents are here, and this is the skin again in the back, the small of your back, and the bones in the back. Then you're looking at the bones and the discs that you hear so much about. The bones are these square, tall squares that you can see the gray color, and then in between them you see the discs. The discs, you notice, are well contained within the boundaries, which is a black line that kind of goes around it. And then they're nice and tall and white, and they're well hydrated. This looks like a young spine, somebody young who hasn't had a lot of degeneration or wear and tear of the spine. So you look at it, it's bone, disc, and so on until here. And this becomes sacrum, which is a totally different story, but generally treated at the same time. The spinal cord, however, it's important to know that ends at the top or just above, or usually at the top of the lumbar spine. So when we talk about the neck, we're talking about the discs and the bones surrounding the spinal cord, and that's dangerous in the sense that if the spinal cord gets damaged, it doesn't recover very well. So all of the things that you hear about spinal cord injury is higher up. Sort of most of the time in the lumbar spine, we're talking about nerves, not the spinal. The spinal cord ends here, as you can see, and then beyond that segment, you can see the nerves hanging down. And so the fluid that surrounds the nerves, it's the same fluid that surrounds the spinal cord and the brain, but this fluid now houses the nerves that kind of hang from the spinal cord, and at every single level next to the disc, a pair of them come out and go to the legs or to the other parts of the body. We'll talk about it later. But if the disc comes back here, or something happens, there's something that pushes on the nerves, or there's some damage, now is the nerves, the individual nerves that go to the leg will be hurt, will be damaged. And the pain shoots down the leg, which is called basically the sciatic pain that you hear so much about. If something happens to the spinal cord higher up, then all the nerves can be damaged, and then we're talking about incontinence, bladder incontinence, weakness, numbness, all these other things that are basically more generalized than just a shooting pain or numbness that goes in one specific area of the leg. Nevertheless, let's not get ahead of ourselves. Basically, we're looking at the MRI, cut someone in half, looking at him from the side, and we look at again, bone, disc, bone, disc, bone, disc. Again, you notice there's a line, which is a ligament, right in front, and then there's one in the back that covers every bone, and the disc goes over everything. And you see it's very smooth with no bumps. That's normal. The other normal thing is that this area where the canal is, where all the nerves in the spinal cord is nice and round and big with fluid around it. There's nothing pushing on the spinal cord. There's nothing pushing on the nerves. It's nice and big. And then the other thing that you notice is that all the bones are well aligned. They're sitting straight on top of each other. And then there's a curvature to the spine, as you can see, which is in the lower back is kind of curves back. We call it a lordosis, just straight back. And then that changes as we go up to the thoracic spine. It reverses it. But this is a healthy looking spine. The bones in the back are nice and straight. There's open canal. Bones and discs are sitting here with containment within their compartment. And all the bones are tall without any fractures, and all the discs are tall and nice and hydrated without any bulge or herniation. And the disc and all the nerves are free. So keep in mind the fact that the spinal cord ends here and the nerves are down here, and what the sciatic pain can be from. And so this was one view of the MRI. You will notice in your view there are different colors of the same picture, basically. This is one where this fluid is white, and that's called the T2 image. And then this is one where the fluid is basically dark compared to the spinal cord. The same exact picture. And this is better for looking at the fat, because there's some fat around it, and if there's fat, there are other things that we can see better on these series of MRIs. But basically, for you to understand is that they sort of show you the same view. So if you look at this one, and you look at the bone and the disc, and then you look at this one, and you look at the bone and the disc, you know what they're talking about. And you wait for the doctor who you visit to explain to you more. Now, again, if we cut this spine sort of across, so if you go across like that and look from below, that's what you see. The belly is in the front, the bones or a disc, depending on where you cut it, you will see that, and then an area where the nerves are, and then the bone in the back. So that's what this is. In this case, you will see the person is cut basically like that. The legs are coming out of the screen, so the left side of the patient is on this side, the right is on the other side, and the head is behind the screen. So right here are the nerves. They're just hanging out. You see there's no spinal cord anymore. There's no round, big, thick spinal cord. All these nerves are hanging out, and we cut them right across. So here's the belly and the contents of the belly, big vessels and kidney and so on. This is the bone in front. That black line that I was describing for you is right here. You can kind of see it right here, and then in the front of the bone as well. Because last time we cut it like that. Now we're looking at a different angle. The white fluid is there, and the nerves are soaking, kind of hanging down. And then in the back, you can see the muscles here, and then the bones here. And then we will see if the disc or something else is pushing on the nerves, you will see it invading this area. Now, another way of looking at the spine that some of you might have in your hand is a CT scan, which is basically the same views as the MRIs, cutting it this way or cutting it that way. But the CT scan is good for looking at the bones specifically. So you don't really see, if you look at the MRI, you see the nerves and the spinal cord and the disc and everything. This CT is really just looking at the bone. So you want to make sure the bones are not fractured and they're sitting on top of each other nicely. And there are some occult fractures that are hard to see on MRI. CT always helps. And also if there is any lesion that has calcification or calcium in it, or in the discs or somewhere else, we can see it on CT scan. So some of you might get a CT scan either because they want to look at the bone, or because you can't have an MRI because of the pacemaker that you might have, or other things. That's beside the point. So if you have any questions, email to us, and I'm happy to answer you as best as I can. And look forward to explain other things to you, and we will further discuss the different pathology of the lumbar spine so you can understand why you might have gotten the MRI of your back in the first place. Okay, have a good day.